Hi, everyone. Small crowd today. I'm going to dive in to a number of different updates. Thanks for joining as always. We have 2,452 cases and are at 104 fatalities due to COVID. We're looking for more volunteers for our drop-in site at Blake Field. And so if people are interested in volunteering, they can reach out to our office. The site has had consistently around 30 to 40 individuals each day using the site, individuals that are experiencing homelessness for different levels of support. And overall it's going well, but we're looking for more volunteers. Would love it if you helped us get the word out. Barbershops and hair salons are scheduled to reopen on Monday, June 1st. I know that for a lot of barbershops and hair salons, this is a highly anticipated day. Just want to remind folks that if they do run a barbershop or hair salon, they need to complete the state self-certification. And of course, we're here to help in any way we can as far as questions or support that may be needed. Tomorrow, we're doing a food distribution in partnership with Vertical Church and neighborhood leaders at Lincoln Bassett School. That Lincoln Bassett School is in Newhallville, and that will happen from 10 a.m. to noon. We've also decided to do a pop-up testing site at Lincoln Bassett School tomorrow as well to capture the opportunity of a lot of people being in one place. And that will be at the basketball court behind the school from 9 a.m. to 12 noon. And a special thanks to Kim Harris for that great suggestion, and to Director Bond and Dr. Murphy for making that happen. Dr. Murphy's team usually gets a break on the weekends, but I'm very grateful that they agreed to do that. As folks know, we've passed 100 fatalities in New Haven, and the U.S. has passed 100,000 fatalities. And around the nation, mayors and clergy leaders are designating June 1st as a National Day of Mourning and Lament. And in New Haven at 10 a.m., we're going to be asking people to take 2 minutes as a moment of silence. And then after that, we're asking the churches to ring their bells in order to commemorate the thousands of people that have died due to the virus. We appreciate you getting the word out about that as well. Director Bond, you had a nursing home update.
I did. I also wanted to just add during your update regarding beauty salon, hair salons and barbershops, during the webinar, I announced that we were going to have a link on our health department website where people can register for an inspection. That link is now live, so we ask barbershops and hair salons to please register and get scheduled for an inspection. Otherwise, we will resume with the schedule, but if you want to get ahead and have a schedule set, that's available to you. With nursing home numbers, I wanted to share a couple of updates. Of course, I like to make disclaimers when we are sharing data. The data is always a static view. It can fluctuate based on the medical examiners or other filtration that needs to happen with areas of margin of errors that could be other residents or other factors that are variables that need to be filtered. And so we always ask people to bear with us with the data. We try our best to inform you with and provide you the most accurate information. So currently what we have here are the positive cases for advanced nursing, Grimes, Mary Wade, and Regal Care. There hasn't been a significant change. We have a slight increase at the Grimes with positive cases of a difference of 3 since my last report. We also have our case fatality rate for each of the nursing centers. I do want to make a disclaimer that previously there was a report of 25 fatalities at Mary Wade. There's a discrepancy with some of that data. The Office of the Medical Examiners are reviewing that data. Mary Wade are reporting 20. And so I just want to make sure that that's clarified, as that was reported in a recent article. We also have staff that have been tested. The next phase of the PPS, the Point Prevalence Survey testing that's being conducted in conjunction with the Department of Public Health, are urging all nursing homes to have ongoing testing for their staff. And so right now, the staff positive cases have been consistent with each of the nursing homes, no major changes there. And I can certainly share some of the data slides with you after this press conference. So just to kind of get a view of the different age groups, this is just a graph for you to view for each of the different nursing homes that we are closely working with and monitoring with the pandemic. That concludes my update. I'm going to turn it over back to the mayor.
Thanks, Director Vaughn. Before I hand it over to questions, I did want to take a moment, and I put out a statement earlier on, a video about this, but to talk about the killing of George Floyd, and just wanted to be absolutely clear about my outrage at that at the murder. I'm relieved that the officer is being charged now, but I think this incident just underscores once again how much work we have to do as a nation to address the inequalities and disproportionate impact, in particular on Black and Brown communities, that unfortunately some law enforcement may have. And to underscore this, in New Haven, the chief and I are doing everything we can to ensure that the work of our police department embodies what we often talk about as community policing. And of course, there's always more work to be done. But I think it's very important that leadership around the nation and leadership in New Haven comes out very vocally to condemn what happened. Unfortunately, I don't think that we're seeing that leadership as strongly as we should at the national level. But I am glad to be here with the chief to make absolutely clear that we condemn what happened in Minneapolis. I don't know if, Chief, you want to add anything.
Yeah, Mayor, I would echo your words, but as the chief, not just of this department, but representing the leadership of departments all around the country, I've spoken to area chiefs, but I've also read, as many of you have, statements made by chiefs all around the country, taking a stand to condemn police brutality. And this is an opportunity for us, and we have to come together to deliver the message that we do not tolerate this. So I stand with this community. But interestingly, what I will add is that this is not just a message from the chief. I can assure you that this is a message from the men and women of the New Haven Police Department. Officers that are out every single day feel the same way. They do not support this. And we are planning a statement that we're going to make. That's going to be coming out. And I wanted to make a collective statement from our department, because I think it's important that the community knows that this is not the chief of the department speaking, that this is a sentiment felt by every member of this department, because we swore to take an oath, and I can assure you that the men and women in the New Haven Police Department feel strongly about that. And we want to condemn any action that amounts to police brutality or corruption. That's not what we stand for. And I think it's time that we stop being silent about that.
Thank you, Chief. Are there any questions? Go ahead, Tom.
Thank you. Mayor, where should people who are interested in volunteering at the Blakefield site, where should they go, or what number should they call? Do you have a website?
So as I was saying that, I was realizing I don't have the exact directions. I'll pass this to you through Gage unless we have those handy now.
Yeah, you can go to the Connecticut Response ct.gov on the City of New Haven COVID-19 page, and they can volunteer through there as MRC volunteers, yeah.
Thanks, Tom.
And how long does the city have funding to keep the Blakefield site up? Do you know?
At this point, we haven't made a determination of when we're going to close it.
But for the foreseeable future,
Correct.
it will be there.
Correct. In addition, the state has extended the timeline under which people that are experiencing homelessness will be in hotels. I forget the exact date, but I can get that for you. It was originally going to be till the end of May.
Thanks. Director Bond, could you give us an update on how the phase 1 reopening has gone? You mentioned a few days ago that you'd received one call about a violation at a drive-through restaurant over Memorial Day weekend. Did you do a follow-up inspection there, and have you gotten any other calls about violations?
So yes, we are closely monitoring that. We did receive a couple of concerns about social distancing, congregate settings, and things of that nature. So the task force and I did do some site visits and some education around that. So we want to make sure that people are just aware of what the new rules are. And so we went out, conducted inspections, but really just a team effort to just create education around the new rules and making sure people understand the social distancing and the importance of proper signage and things of that nature.
If I could add, so each municipality is required under the governor's orders to designate a person that's responsible for overseeing the inspections, and I've designated Jim Tercio to do that job. And Jim has been working with the fire department, the health department, the police department, and his own department to do outreach and some inspections around the city. Our goal is not to get people in trouble. Our goal is to provide information and make sure that restaurants, retail establishments, and other establishments are operating safely.
Thanks. And then my last question for the mayor and for Director Bond is just kind of generally speaking, how do you feel the phase 1 reopening has gone so far? And do you feel like the city is prepared for barbershops and salons to open on June 1st?
Do you want to take a stab at it, and then I can
Sure.
try?
I think overall it's going really well. We held webinars for each of the sectors that were going to be opening, and that was a really good success. We did a second webinar this past Tuesday for hair salons and barbershops. They certainly have a lot of questions, and I feel like a lot of businesses have taken the proactive approach. Again, we gave minor recommendations, but I just commend all of the businesses for modifying and adjusting their day-to-day operations.
If I could add, I think overall it's been going well. I had lunch for the first time, a private lunch with the governor that was joined by Tom Breen, it was interesting just personally to be in the position where the wait staff, you're thinking what's going on behind the scenes at the restaurant to make sure that they're keeping you safe. And we talked some with the wait staff at Portofino's and about how they were making sure that they were keeping us safe by changing gloves between each time they came to the table, and just other things they're doing in the kitchen. And what I've been overall relieved about is that it's been slow. The opening has been slow, and different establishments are opening up when they feel ready. We'll ultimately, I think the one concern I have is that we won't know if there's a problem until a little bit later, because we won't start to see additional cases until, or there's a delay until we see those additional cases. And so we're monitoring those closely, both the hospitalizations and additional cases. But so far, so good.
Thank you very much.
Yeah. Michael, you had a question.
The same subject of salons and barbershops. Just so I'm clear, do they have to get inspected before they can reopen on Monday? Director Bond?
They do not have to. They're being scheduled starting June 1st because that's when they're allowed to operate.
Well, do they have to get inspected ever?
Yes, they have to by law get inspected once a year.
And so is there a time frame by which they have to have this completed in order to remain open?
Yeah, we will have the time frame. We will be making sure that we're going to be, we have a schedule set, but we wanted to allow the hair salons and barbershops to also pre-select. A lot of them were eager to get inspected already. So we were just having this as an option for them.
Okay. And what's the testing, the inspection capacity for how many you can do in a day or a week or any time period?
So the inspections vary depending on the sector that we're inspecting. So if it's an outdoor restaurant, it can be anywhere from 1 to 2 hours. If it's a nail salon, usually 45 minutes to an hour.
And do you have any idea how many salons and barbershops there are in the city limits?
Absolutely, we have to track that. We license all of, we keep track of all of the businesses that are within the city of New Haven. So we have a listing of the different establishments that are within the first phase and going into the second phase. And we usually assign them by ward, and we have a system of how we assign them to the sanitarians.
And how many are there roughly?
I don't have that number in front of you, so I don't want to give you inaccurate information, but I can get that to you.
Okay, thanks. And are there any particular compliance issues that would be unique to salons and barbershops? I mean, you can't cut somebody's hair from 6 feet away, obviously.
Yeah, so we want to make sure that we did a webinar. You can actually find that webinar on what the new rules are and the inspection process and protocols on our website. We did post that on our Together New Haven, so you can definitely check that out. But what we were going to be looking for is making sure they have a utility sink that's separate from a bathroom sink, for example, making sure they're following the proper sanitation, that they're following the proper protocol with wearing the proper PPE, not having, making sure they're scheduling appointments and not having too many people congregating inside of the hair salons or barbershop and things of that nature. And so I outlined that in the webinar that I presented twice now in the last 2 weeks.
Thanks for the amplification.
You're welcome.
Go ahead, Ben.
I have a question for Chief Reyes. I was just wondering if you could share the department's policy on when officers are supposed to wear masks. I saw in the body camera footage of the arrest at Walmart last night that some of the officers weren't. And I'm just wondering when they're supposed to and when they're not.
And so, thanks for that question. It's a tough balance. So the policy says that anytime they're going to come in contact with the public and even in close contact with themselves, they have to wear a mask. Obviously, officer was calling for help. They were going there, lights and sirens, and what you saw there was the aftermath of that. So, certainly we prioritize officer safety and general public safety, and we're enforcing these policies. But under those circumstances, I certainly understand why the mask wasn't the first thing on their mind, but we do reinforce that.
Thank you.
Any other questions? Go ahead, Tom.
Remember when I forgot to ask? Thanks. Director Bond, do you have an update on how many total tests have been conducted in New Haven? I know you gave us an update a couple weeks ago. I was wondering if you had that on hand. And then a quick follow-up to that is this number and also the number of infections you share each day, are those active virus tests or are they a mix of active virus tests and antibody tests? Remember the CDC got in trouble a couple weeks ago for announcing that they were mixing the two, and they really track two very different things, as you know. So
You're on mute, Maritza.
Sorry, I'm muted. That's a really good question. So let me answer the first question relating the total number of tests in the city of New Haven. So this is, again, approximate of the electronic laboratory records that we get. We have over 13,236 tests that we have achieved in the city of New Haven with a 23% positive rate. And again, this has a lot of variables that we have to consider, but in general, this is what we have in our surveillance system. And your question regarding antibody testing, that is something that the Department of Public Health is now adding as another reporting metric. And so it is not combined currently, but we will be reporting those numbers out in the near future.
Great. Thank you very much.
Yeah, that was a really good question because that was a concern as a whole.
Any other questions? All right, thanks so much, everyone. Good to see you. Have a great weekend.
We're going.